Welcome everyone. It's lovely to see you all here today. My name's Alison McKenna. I'm a consultant clinical psychologist from Southeastern Trust's Regional Trauma Network. And with me today, I have Karen Morgan, Health and Wellbeing Case Manager at the Victims and Survivors Service, and Sheena Rigg, the Implementation Manager in Trauma Informed Practice from Safeguarding Board Northern Ireland. Thank you everyone for completing the poll as you entered. We're keen to know how far and wide we're reaching, so we're very grateful to you for completing this. And this is the third in our series of 6 Lunch and Learns, so we will have 3 more after today, and this covers all 10 focus areas of the SBNI's Trauma-Informed Organisational Toolkit. All sessions will be via the same link and passcode on Zoom, just to make it easy. So you're all very welcome to attend the full series, and hopefully we'll see you there. This session, as is the case with all the Lunch and Learns, this session is recorded and will be uploaded to the playlist on YouTube after today. Your mics have been deactivated, but we will take questions at the end. And with it being a lunch and learn lasting 40 minutes, it can only be a brief introduction to the topic, but we will send out to you a link to the full organisational toolkit if you provide us with your email and your name. So if you would like to receive a copy of the slides we'll be using today, as I said, a link to that recording and a certificate for an hour's CPD and any other resources we may have, please enter your details in the window that will be appearing on your screen in just a moment. Unfortunately, we're not permitted to send out resources certificates, if people enter their details after 1:10. So if you want a certificate, please enter your details in the poll by then. So we need your name and your email address, and I would also ask you to please be patient with us because we have a small team, so it takes us a wee while to get the certificates and the resources all sent out to everyone. And we are really keen to obtain all your feedback. We very much value that, so please answer the polls that will come up at various intervals. Please note that most of the polls, except for the one at the very end, are just tick box, so it shouldn't take a moment to complete them. But we use your feedback in order to plan future lunch and learns. And also we have a webinar series that has started. We had our first webinar of 2025 a couple of weeks ago. The next webinar will be on EMDR, and it will be run by Professor Alistair Black from Belfast Trust. And if you've been to our earlier Lunch and Learns or the last webinar, you will have been advised that the date would be the 23rd of April. But unfortunately, we realise that isn't the best week after Easter, so it's been rescheduled to the 30th of April. And we will be circulating that flyer far and wide, so hopefully you'll get it and you'll be welcome to come along. And then all our Lunch and Learns and indeed our webinars are co-designed and co-delivered between Health and Social Care and the Victims and Survivors Service. And in this collaboration, also co-designed and co-delivered with Safeguarding Board Northern Ireland, whose toolkit the series focuses on. Okay, so I will now hand over to Karen and Sheena.
Hi, everybody. Glad you could join us here. So my name's Sheena Rigg, and I'm going to be giving you a little bit of a snapshot about trauma-informed policies in particular, I suppose, and just giving you a bit of an extract from our toolkit and from recent research as well. And I'll hand you over to Karen.
Hello, everyone. Thanks for joining us today. and I from the Victims and Survivor Service, and I'll be focusing on the environment and the values that go along with those, and hopefully giving you practical examples that you can use in your own organisation, take away today. So just to give you a bit of background, in June past there, Victims and Survivor Service were successful in achieving the silver trauma-informed quality mark from One Small Thing, and they had looked at evidence, our policies, procedures, and our practice to determine that our trauma-informed practice is implemented across the culture, practice, and environment within VSS, and that we prioritise individual needs and well-being. Just hand it back over to you, Sheena.
So I suppose that some of you will have been at previous sessions before regarding the toolkit, and this is, as Alison said, this is a series, I suppose, focusing on this. And I suppose this graphic, this infographic, illustrates this idea of what we're trying to achieve within our toolkit in terms of incorporating elements of practice. Really at the centre of developing a trauma-informed organisation is this idea that relationships are absolutely key to this. Relationships with the people we provide services to or we work with, but also with our colleagues, with those we manage, the people who manage us as well. And this infographic kind of incorporates everything all together. The trauma-informed principles, both Karen and I are going to refer to, and Karen's going to give you really practical examples in that environmental kind of aspect, which is really important. And I'm going to refer to them in terms of where they're evident in policies and how we can review and make sure that our policies, and then from that our practices, are really fully trauma-informed. And I suppose it's a bit of a cliche, and our research says this, but it is a journey. We are always learning, we are always improving and reflecting, and you know, we don't get it right all the time. So, and that, you know, reflects all of our systems as well. But becoming trauma-informed organisation is not a one-off activity. It can't be delivered in silos. So we need to have these layers and layers of both kind of concepts, but also practical approaches as well. And it does require systemic culture change and ongoing work at all levels. So we need that at practitioner level, and we need it right up at leadership level, and we need it at those who are developing or reviewing policies, whatever the size of our organisation. Next slide, Alison, please. So these trauma-informed principles really are how we embody a trauma-informed approach. And the really key one is about safety, but we can use these principles to kind of look at policy development and think, are we offering choice to this policy, or how much can we offer choice, or are we really working in collaboration? Is our language excluding people? So using each of these ones can really help to kind of filter through. So the next slide, Alison, please. So I'm going to just give you some examples of how you look at a policy through a trauma-informed lens. So this concept of lens is not original, but I suppose if we're putting our trauma-informed glasses on, and we're looking at this, being aware of the prevalence of adversities and trauma in our population, not just in those we deliver services to, but within our own workforces and within ourselves as well. So the idea of looking at a policy through a trauma lens is just from a slightly different stance. And also it needs to be in a kind of appreciative inquiry approach as well. Not everything will need to be reviewed, so I suppose a good positive stance is already to look at your policies and think, which are already trauma-informed. And NHS Scotland always say, don't assume there aren't any, because we've all had to write policies according to legislation, which really guides us. There will be policies that we've really consciously tried to be very careful about our language. and being sensitive to, and they may already be sensitive to adversities and trauma. So those policies, right, like about confidentiality, about equality, you know, about making sure that the language is accessible or inclusive, may already exist in your organisation. So we're not all starting from zero or from developing all of our policies. So keep that in mind. I suppose then the idea of the trauma lens then is thinking, and what ones really do need to be prioritised, and you know, really think about those ones that need to be taken on these principles of trauma-informed practice. So if we're thinking about supervision, and this is a really key one that we will come back to briefly as well, that our staff are working in difficult situations, they can be bringing their own adversities and trauma with them as well. So how can we support that? What can supervision look like? And it doesn't always need to be that one-to-one, it can have different forms. But that really needs to be considering that our workforce's well-being, so it really should be looked at. But there's all sorts of other kind of practices and policies, you know, about privacy, about staff discipline, that really need to be addressed and really carefully looked at, our languages. Also, sometimes we've got new policies being developed, and that could be because there's new legislation emerging, there's been some sort of serious incident possibly in our organisation or in society, in Northern Irish society, that means that we need to consider this. Or, you know, so there can be various reasons. It could even be climatic and environmental. It could be, right, we need to have a recycling policy that really is realistic and achievable, or whatever that is. Then the other aspect is thinking, when are these policies due for review? Anybody who has responsibility for this should have a timetable. There will be policies that need to be looked at yearly. There will be others that will be 3 yearly or whatever. So look at the timetable and really, you know, take it in bite-sized chunks, I suppose, because you can't do everything all at once when it comes to reviewing a policy. And then the other really key thing is, who is reviewing policies? So in some of the big, in our health and social care trusts or in other larger organisations, there may be a team who have a response, or a committee who's responsible for this. And do those people, are they as au fait with trauma-informed practice as others? Do they need support? Do they need specific training in order to support them to facilitate this idea of looking at the policies they're reviewing or developing through a trauma-informed lens? So there might be aspects or particular parts of your organisation that really need help and support. And it's then bringing in these people, raising their awareness, and really helping them consider what an important role they have and how they can support the development of this, and work alongside people who are maybe more practitioner focused. The other thing, I suppose, is, of course, we have to think about the impact of policies you know, so using the trauma-informed principles is really helpful for that, to thinking about impact. So next slide, Alison, please. And I suppose another device that we use is this idea of the lens that we already talked about as well. And we've got this little card that you can access and download as well. And we're developing this and going to print this out. But I suppose it's thinking about, who does this policy impact upon, and how does it impact them? So is this about who can access a service? What are the obstacles that are put in people's ways? You know, is there like a brick wall, or is it an open door to access our particular service? Or are there hoops that have to be jumped through as well? And then also thinking about even how the policy is worded, looking at it and looking at the language and saying, is this accessible? Is it both accessible in terms of, you know, the public can access it on our websites, or is the language accessible as well? Is it translatable, and, you know, and does it apply to people from different cultures as well? Then the E in the explore is the thinking about, this is more a reflective side of the trauma lens. Could it be could it actually make the service more efficient? Could we really review this to make it tighter, to make it more effective, more culturally appropriate as well? And I think Karen and her organisation really had to kind of comply with some of these aspects as well, really consider these developments as well. And then thinking about needs as well. Is this policy really needed? Is it a reactive policy because something has gone wrong maybe or awry? But we need to be clear that policies are all purposeful and really guide practice and are really used by practitioners as well. And it needs to be succinct and clear as well. And then lastly, the S, the acronym of the lens, is that, you know, these people who are writing it, and does the policy actually support the workforce and those who use it, or those who access services, or is it actually a block and it's filtering out? So, and does it support relationships as well? So that's another kind of just a little kind of tool that enhances that idea of a trauma lens. Alison, the next slide, please. So, some of you will be aware that we had new research launched last week on the 6th of February, so to great excitement. And this is led by Queen's University Belfast, led by Dr. Colin Walsh. And he looked at the prevalence and impact of adverse childhood experiences in Northern Ireland. So it's the first of its very specific kind, you know, really applying to our society. And the policy testing he referred to as well in this research as well. So that idea of thinking about who is impacted by a policy, but also if we look at the policy in a trauma-informed context, where are the overlaps and the duplications between policies? Sometimes it has been said in Northern Ireland, we used to launch ships and now we launch policies, that we have a multitude of policies, some of which overlap, and some they're all important, but is a huge amount so that there is a lot of duplication, and it might be useful to kind of you know, consider that and really think about minimizing or making sure that there's not too much duplication as well. But also it means that if we look at this trauma-informed context, we're thinking about the decision makers who really think about, well, how is this going to affect our Northern Irish society? And do policy makers at that highest level really understand the impact of adversities that can be experienced domestically in the home, but also are experienced by children and young people and adults in the community? So that exposure, this study obviously is about exposure to violence and witnessing violence, as well as the individual's experience as well. So a policy like this can frame the commissioning of services as well. And the next slide, Alison, please. Not that. So this is just an extract from the toolkit, just to promote that. Some of you will know about it already, and the link is on the end slide of my part of the presentation, but this is a useful checklist that you can use as well. The next slide, Alison. And I suppose supervision, there's many policies that are really important, but this is just an example of how we need to think about the well-being of our staff through a supervision policy, and whatever that supervision means in terms of our organisation, but it really needs to have a focus on our staff care and wellness and well-being, and making sure that it's really specific and supportive for our staff as well. So lastly, the next slide, Alison. Yeah, so these are just some links that you can use. Our training brochure that's available there, the checklist that you saw a little page from, but the whole toolkit is there to support organisations to really embed this, and policy development and review is an important part of that. So I'll hand you over to Karen now.
Thank you, Sheena. So just to recap, I'm going to be looking at the environment, and with the goal to create an environment and organisational culture that embodies the 6 principles of trauma-informed practice, which are inclusion, safety, collaboration, empowerment, choice, and trustworthiness, where staff's experience at work across sectors is the same as the experience we wish for those who are availing of the service. And I'm just going to look at each one individually and just show practical examples of where we met that, where we promoted inclusion, safety, collaboration within our physical environment. So can I have the next slide, please, Alison? We'll pause here just to complete the poll. Just take a wee second, please. It's just one tick box. Okay. Thank you, Alison. Thank you. So within choice, this is a picture just of our reception, and we promoted choice by giving the clients they have a choice to engage with VSS either in person, online via our website, via email, or over the telephone. These options enable clients to choose what works best for them and allow survivors living outside Northern Ireland to connect with VSS. And they also have the option to speak with male or female staff. So have a look at what you're already doing, and chances are that this is really easily achievable already, and you're doing most of these things in the right way. Next slide, please, Alison. So the next one was trustworthiness. And following survivor feedback, VSS recognised the view of a religious building from our meeting room window as triggering and re-traumatising. And this was for survivors of historical institutional abuse. So VSS responded by obscuring the view with frosting, and that was done through a co-design process with victims and survivors involved in the review of the physical environment, ensuring that this was a welcoming space and not activating. So we asked for their opinion. We asked them to help us design an appropriate space that would serve them best. And by listening to the concerns from survivors, this helped us to foster trust among clients by demonstrating that their views and perspectives are valued and that they contribute to establishing a safe environment. So that we're saying to them, no, your opinion is important, and that we're going to do something about that to do right by you. Okay, next slide, please. So this shows our sign for the 4th floor, and it differentiates the difference between victims and survivors for troubles and conflict. And on the 4th floor, it's a dedicated space to survivors of historical institutional abuse and mother and baby homes and Magdalen laundry and workhouses. And that came about through collaboration with staff, clients, and families to involve them in decisions about the spaces that they will use to provide opportunity for tailored responses. And that ensures inclusivity and reduced potential re-traumatization. So this co-design process with survivors involved a review of the physical environment, ensuring this was welcoming and not activating, and survivors had made recommendations based on actual and perceived safety concerns. We responded by creating a distinct and dedicated floor for the HIA survivors, which operates separately from services for survivors of the troubles and conflict. And that can be seen clearly as soon as you come into the building, that there is a differentiation between them both. Okay. Next slide, please. Thank you. So empowerment, and again, you will be limited to what you can do with the resources that you have. But a recent meeting with a permanent wheelchair user identified that the dedicated client room doesn't have an automated arm to be opened independently by the wheelchair user themselves. So this feedback has informed positive change, and it's led to us putting in a request with our buildings contractor to have the current door automated to enable independent access. But we went further then and let him know that because of his experience and his feedback, that we were able to implement changes, and how we again value their feedback, because it was something that, while it's a wheelchair friendly door and the size of it, that actually practically it wasn't good enough. So we have made changes to that. And again, it's just keeping the people that use our service in the loop and asking them for that valuable feedback. Next slide, please. So again, feedback from another HIA survivor was about inclusion, and they had stated that having the lift was also helpful, as again, the service, as I said, is on the 4th floor of the building. So it meant that they didn't have to walk up loads of flights of stairs. That's particularly important for some of the members with mobility issues. All in all, they felt safe and supported when they come into the VSS building. And that feedback helps us know if we're doing it right or if there's something that we can do better. Next slide, please. Okay, we'll just pause for a second, ask you to kindly complete another poll. Just how has your knowledge been before this and how it's going now?
It's just 2 tick boxes. Apologies for the red lines. I'm trying to get rid of them. I don't know why they're there.
I'm glad you said it. I just thought there was something wrong with my screen. That's okay.
No.
My computer's not dysfunctioning. Okay, thank you. So physical safety, it's important to think of physical safety for our clients, especially our client base. So we have a dedicated client room that offers space and ensures privacy and confidentiality when survivors are meeting with staff. The reception area is manned at all times. So if somebody does show up unannounced, there's somebody there to greet them. It's well lit, it's a comfortable, clean space. The reception desk has 2 heights for accessibility for wheelchair users. We have a hearing lift for those who have difficulty hearing. We have the jam card, which is just a minute card, and all our staff have that training just to be able to respond to people that are presenting with, you know, many different difficulties. Okay, next slide, please. So psychological safety is also very important, not just to the people who benefit from our service, but also to our staff. It's important that they feel psychologically and physically safe. So the photograph on the left, I don't know if you can make it out, but this is what's called our cozy corner. We have this on the first floor, and it's a space for staff that they can sit and have a chat, sit and have an informal meeting, sit and have their lunch. And we ask everybody, you know, to put up an inspirational quote on the board every few weeks. We also, it's somewhere that we can have shared information. Most importantly is the box of chocolates you can see on the table. But that information that we share would be on workforce initiatives, self-care strategies, anything that's coming up, if it's International Women's Day, Men's Health Week, all those different occasions. And this space is to promote psychological safety. All our staff are trained to recognize and respond appropriately to people already in survival mode whenever they're arriving. As you can see on the right-hand side, that is the little passage, and it's actually taken straight from Dr. Karen Treisman's Toolkit. Again, there's loads of resources out there. You don't need to invent the wheel. And it was quite cheap to do. And it's put in all our bathrooms, men and women's bathrooms too. And it has a scrub out of Lush, and it's quite a strong aroma, but it's like a salt crystal. And it's encouraging people just to take that moment while they're doing an everyday task of washing their hands after using the bathroom. And it's encouraging them just to engage in a few minutes of mindfulness. And that has had a lot of really good positive feedback from our staff. The Cozy Corner was designed by the Trauma Informed Working Group, and that was done by sending out a poll to all staff, so everybody have an idea, what can we do with this space? What do you need to help you feel safer? What do you need to feel supported in your job? And it's also a space where it promotes psychological safety by connecting the staff from different departments who you might see in the building, but also we found it's important for staff who are working remotely to feel connected to, and that's done through a number of different ways, through staff meetings, through Teams, through just check-ins and phone calls, just to reduce those feelings of isolation for people who are not in the building, who can't experience that cozy corner. And spaces where people feel they belong and are valued will be open and inviting. And this will also facilitate social connection. That was taken from Delaney in 2018 that can in turn build community resilience and healing. So it's just giving somebody a place just to take a minute, reconnect and take a breath. Next slide, please, Alison. So practically, what can you do? These are questions that you can ask yourself to help yourselves get started. The impact of trauma is across the lifespan, and it's not the same for any two individuals. It's not the same for any two organizations either. So ideally, therefore, all spaces should be trauma informed, and any space can be if you give it careful consideration. So these are questions you can ask yourself to find out, has your organization integrated the 6 core values across their physical spaces, and have they extended them to all service locations? Where physical modifications are not feasible, can you outline the specific strategies to ensure individuals are supported in alignment with these values? So if something that you can't change, well, what can you do just to help promote those values? And while applying trauma-informed principles to future building and facility design is important, organizations can take initial, less intensive steps that will lay the foundation for physically and emotionally safer environments. So you can do small, easy things, easy achievable now. So you just ask yourselves, how does your organization support the people who use your service to feel safe? How do you recognize and respond to needs of your staff within the physical environment? We did that through staff surveys and through engaging with our workforce wellness working group as well. How are they supported to practice self-care? Do you do annual walkthroughs and maintain an action plan for implementation, monitor and review? And evaluation and review is really key to that. So we're due for another walkthrough at the minute. We do it every 6 months, and we see what we look at what has worked, what has not, because it's really important to put a fresh pair of eyes on it, because you come desensitized to the space, especially if you're in every day. It's important to ask the people who are coming in as well. So the next slide, please, Alison. Thank you. And this is actually quoting Alison from the Southeastern Health Care Trust. So part of our commitment of implementing trauma-informed approaches was sharing that knowledge and experience. So this is a quote from Alison, who was very grateful when I was willing to assist her with a walkthrough. And it resulted in the identification of numerous changes that we could make for the better. So what happened was I had gone out to Alison's hospital with a fresh set of eyes and just made notes of how I experienced it, using the trauma lens, and also thinking about what that would be like for somebody who benefits from the service, and just give that feedback. And based on that feedback, and using just the sort of fresh set of eyes, the changes that Alison and her team were able to make were improved signage for the building, clarity about how to operate the door on exit, which is very important if somebody is coming in and they're anxious or upset or they're fearful, it's their first time. Future placement, furniture placement, moving some of the chairs about and the bookshelf just to make it a more clearer place and safer, less intimidating. Therapeutic color schemes, information sharing, especially trauma-focused literature, so that the literature and that the leaflets available and the books available were more appropriate for the people who were going to be using that space, and that they felt valued. And they were also able to secure funding for the project and hope that they can proceed with the changes in the near future. So what I would encourage you all to is just to link in with each other, ask questions, ask for people to come and have a look and give some feedback, and really promote that trauma-informed network, because we can all do better and we can do better together. Next slide, please, Alison. Okay, can I ask you just to complete this poll? and take a minute. There's 5 questions. How well did the session meet your needs? What's the most least useful? Anything we can do better? Would you recommend this to a colleague? And what ideas would you like to see in the future? Okay, next slide, please, Alison. So just to sum up, the environment, it's about creating a safe environment for both physical and emotional safety. It requires intentionally and comprehensively incorporating trauma-informed approaches and practices into an organization's structure, service delivery, and the culture as well. And that's taken straight from the QUB research from 2024. We have 4 minutes left. I'll just open it up for questions then.